welcome to our webinar. I'm Dr. Preeti Chabria. I'm a consultant in internal medicine and a lipid specialist here at Hinduja Hospital. Prior to this, most of my work experience has been in the US, where I practiced for about 15 years. The reason why I have been so interested in lipids is because heart disease has emerged as the leading killer among Indians. In fact, it overtook infections to become the leading cause of death among Indians in 2010. And the unfortunate news is that heart disease affects Indians at a much younger age with respect to the North Americans or the Europeans. So there's a great need to address this epidemic with prevention of the very first and all subsequent heart attacks. And actually lipids can play a big role in that. Now, if you look at the major risk factors for heart disease, the age and the family history of heart disease are non-modifiable. But if you look at the modifiable risk factors, out of the four, two of them are related to cholesterol. So cholesterol can play a very important role in preventing heart disease. Now, when you go in for a lipid profile, when you do a fasting lipid profile blood test, it will show you these following parameters. There'll be the total cholesterol, the LDL, which is the bad or the harmful cholesterol. This is the cholesterol which, clings to the blood vessel wall and forms those the heaps of cholesterol which are called plaques, and these can block the arterial wall openings and cause what is called atherosclerosis. So that's the bad one, that should be kept low. The HDL is the good or the protective cholesterol. The higher this is, the better it is for you. And then there is the triglycerides, which I call as the sugar cholesterol because it's derived from a lot of the sugar in the diet. And then there is the total cholesterol to HDL ratio. Now, this subsequent data which I'm presenting to you is all coming from the adult treatment panel guidelines of the National Cholesterol Program in the US. Now, these guidelines recommend that we should start screening all individuals with a fasting lipid profile starting at the age of 20. That makes perfect sense for us Indians too, because heart disease starts very early in Indians. Once, if you do it at 20 and it's all normal and you have no risk factors, then you can wait another 5 years to recheck it. But if you have risk factors and if there are any abnormalities, then you need to check sooner. Now, the guidelines recommend that the primary goal of lipid treatment is the LDL. We need to keep that LDL or bad cholesterol under control. Now, what we do at the lipid clinic is there's a lot of science attached to this. We analyze all your risk factors and a lot of calculation goes into this, and then we assign you a risk of heart disease over the next 10 years. So those who are very low risk, we assign their LDL goal to be less than 160. On the other hand, if you're very high risk, then your LDL goal is to be less than 100. On the other hand, moderate risk people are kept with an LDL goal of less than 130. So as this slide shows, we risk stratify people. So there's again that science, and then we assign the LDL goal and the goal at which we need to start treatment. So a lot of analysis of data provides us with this and these numbers. Now, coming to the triglycerides. High triglycerides do increase your cardiovascular risk. High triglycerides are caused by certain drugs. It can be seen with diabetes, overweight issues. It can be with a very high glycemic or high carbohydrate diet, and even large intake of alcohol can raise the triglycerides. Now, any 1% decrease of HDL cholesterol can increase the heart disease risk by 2 to 3%. An HDL cholesterol more than 60 is actually a very good protective. In fact, it's called a negative risk factor. So as I was saying about the HDL, the good cholesterol, the higher it is, the better for us. In fact, if it's more than 60, it's actually a protective risk factor. And 1% decrease in HDL cholesterol increases the heart disease risk by about 2 to 3%. Common causes of this is inactivity, smoking, diabetes, being overweight. Certain drugs can do it. And in Indians, I see a lot of this runs in families. So genetics also plays an important role in having low HDL cholesterol. Now, lipoprotein A, there are other risk factors, apolipoprotein B, small LDL particles. Again, these are additional risk factors, but the guidelines clearly recommend that they don't play a role in, so we don't really need to check them or even follow them. The only time I will check a lipoprotein A is when I clearly see my patient who is at high risk but is refusing to get started on treatment. Then I just do a lipoprotein A to kind of prove that, look, there is additional risk. Please, let's take this seriously. Okay, in terms of treatment of the high lipids, the key and the backbone of treatment really is lifestyle changes, because this is what is going to hold us in good stead for the long term. Exercise, any form of exercise. It could be brisk walking, it could be a run, it could be the stationary bike. As long as we get about 30 minutes on most days of the week, that's what we recommend to help control the cholesterol. In addition, diet changes, we would recommend that dietary cholesterol intake be less than 200 milligrams a day. Now, cholesterol-rich foods are like the yellow of the egg, the red meat, then we have the shellfish like crabs, lobsters, prawns. Then even the saturated fat intake should be less than 7% of all the total calories. Now, saturated fat is obtained from butter, ghee, vanaspati, dalda. Any fat that sits solid on a table is saturated fat. But not all fat is bad. In fact, we encourage the intake of monounsaturated fat, which account for about 10 to 15% of total calories. Now, monounsaturated fat comes from the rice bran oil, the olive oil, canola oil, mustard oils. So these are the good fats to take. Other measures that we can take is if you take oatmeal every day, that helps to lower the LDL cholesterol. Increasing your intake of fiber, fruits, vegetables, legumes, that's really going to be helpful too. Now, if your lipid specialist decides that you need medications, then the major group of medications are the statins. These have been clearly shown with all studies available that they do lower the risk of heart disease, prevent mortality, that's deaths from heart disease. They play a very important role in primary and secondary prevention. They do lower LDL cholesterol very effectively. They raise the good cholesterol and play a small role in reducing triglycerides. The only time when lipids are not to be, the statins are not to be used is in women who are pregnant or planning to get pregnant. I personally don't use it in women in the childbearing age. Now, statins are generally very well tolerated, but when I start anyone on a statin, I generally like to inform my patients of the potential side effects. So there can be like muscle aches, cramps, muscle weakness, alteration in liver enzymes, and drug-to-drug interactions. So when a patient takes a statin, he or she should notify other specialists prior to starting other medications that they should look for any drug-to-drug interactions. I can share an anecdote with you. Most recently, I saw a patient who was on 2 drugs for her cholesterol, and she came in with severe aching and cramping. And she had been put through a number of tests, investigations, but I felt it was due to the drug combination. When we stopped one of the medicines, she really did well. So, patient education is very important because that plays a role in, being on top of what's going on with you. But having said all this, in my 12 years of experience with statins, I've seen that they're extremely well tolerated. Now, if at all your lipid specialist needs, we can always add on. If statin alone is not enough, we can add on other medications. But I want to emphasize something called fish oil supplements, which have a large amount of omega-3 fatty acids. These do play an important role in reducing triglycerides. In fact, they can reduce triglycerides by about 50%. Now, low HDL cholesterol in people who are low risk, exercise, cessation of smoking, And weight loss will help to raise the HDL cholesterol by about 30%. If, however, a person already has heart disease and has low HDL cholesterol, then we like to add on a medication, something like a fibrate. Oh, okay. Now, my pet peeve is geriatrics, so I always bring this up in all my presentations. For our senior folks, if they have known heart disease, they should be on a statin. But in primary prevention, our senior folks have to be evaluated on an individual basis. We have to identify the risk ratio, risk-benefit ratio to see whether they really should be put on the statin, because these folks are a little more sensitive to the side effects of the statins. Now, any person who keeps their cholesterol well controlled has a dual-edged advantage in the sense that you can even prevent strokes. And anybody who's had a stroke, if you have them on a statin, we want to keep their LDL cholesterol less than 70. That prevents subsequent strokes. I want to make a mention of metabolic syndrome since it's very common among us Indians. It is a syndrome which is defined if you have 3 of the following 5 criteria. There's truncal obesity, high triglycerides, high blood pressure, low HDL cholesterol, or high fasting sugars. This does increase the risk of heart disease and even the risk of subsequent diabetes. Now, if metabolic syndrome is identified, we want to be aggressive on keeping the cholesterol well controlled. We want to keep the blood pressure well controlled, raise the HDL cholesterol, and weight loss, low carb diet to prevent the diabetes. Okay. Now, if I were to summarize our talk, I'd say take the step to check your lipids. Don't be afraid of medications. Don't be afraid of the statins if they're given to you. Adopt lifestyle changes. Healthy lifestyle is going to hold us in good stead, like I said, long term. And whatever modality of treatment you choose, make sure you follow up. This is how we can convert our potential silent enemy, that's the lipids out there, to become our greatest ally against this epidemic of heart disease. So thank you for your attention, and I will now leave the panel open for questions. There's a question we have from Vijay. Doctor, are there any visible signs of high cholesterol like on the eyelids? So Vijay, yeah, there is you can see those, those pearly white heat bumps on the eyelids, but really we don't see that in every individual, and you don't have to wait for that to actually initiate looking for high cholesterol. That can be at a late stage. It's not very indicative of the degree of cholesterol. So really, by and large, the lipids are a silent problem. So we want to kind of address it before even waiting for skin changes to appear. So Vijay asks, it's not indicative of the level of cholesterol, right? Correct. It does not give us any indicator of, how high your cholesterol is going to be. Many times it is not even directly related to cholesterol. There are instances when it's not directly related to cholesterol too. I've had several patients who have those bumps, and when we check the cholesterol, it's normal. So no, it's not clearly in line with how high your cholesterol is. We have another question. Can cholesterol affect diabetes? That's a very how should I say, it's a chicken egg kind of question that you present. They are linked, as you saw in my presentation. High triglycerides are seen in people with diabetes. Low HDL cholesterol is seen with diabetes. We see a lot of cholesterol abnormalities with the metabolic syndrome, which eventually leads to diabetes. So, it's not that the cholesterol per se can cause diabetes, but they are individual risk factors for heart disease. Let's put it that way. And since diabetes is such a high risk factor for for heart disease, that we like your LDL cholesterol to be less than 100 when you have diabetes. So in that respect, we are aggressive when you have diabetes to keep your cholesterol even better controlled. But per se, yes, if you're your cholesterol, I mean, if you eat a lot of greasy foods, cholesterol-rich foods, they will also affect the diabetes in other ways. So, not it's a very intricate question. Like I said, there's no direct linear equation to this. Kaustubh, how can we know which food has good cholesterol? Yeah, so now the labelings are going around, uh, so you can check for the HDL cholesterol on your food labels. As a general rule, if you see walnuts, they are a good source of the HDL cholesterol. But again, you don't want to eat too much of them because again, they can actually very calorie dense. So, no specific as such food will bump the HDL cholesterol, but it's more of activity, cessation of smoking, and weight loss. Then Gami has a question, what could be the minimum age to check indications of diabetes? Really, there is no minimum age. If you have a family history of diabetes, it's a good idea by age 20, you should get your sugars tested. If a person has the juvenile onset diabetes, that presents symptoms even in childhood. So I don't think there's any cutoff age, but if you are overweight or you have a family history of diabetes, you should be early in checking your blood sugars. So here's a question, what are lipid-based nutrient supplements? I'm not sure whether you mean what supplements, but the only supplement I'm aware of is the fish oil supplements. The fish oil supplements provide omega-3 fatty acids, which help to lower the triglycerides. So that's the supplement that we have available. Kaustubh, how can I protect my lipid from oxidation? Are you talking about the lipids in your blood? I'm not so sure I understand this question very clearly. Lipid in your blood from oxidation. I don't think we have to, I think you're worrying about the small, dense LDL particles and the problem it causes with atherosclerosis. So rather than wait for the problems of atherosclerosis, the first thing we really need to do is keep the levels well controlled. So work at it at the primary level by keeping these markers which we said, keeping your LDL goal well controlled, keeping your triglycerides well controlled, your HDL at goal. That's the thing you can do. In terms of prevention of atherosclerosis, your lipid specialist, based on your risk factors, will decide whether your risk benefit ratio warrants you to be on a small dose of an aspirin a day. That helps in a blood thinning effect. It prevents these blockages also from occurring. But at your level, I would say, where you are right in the primary prevention, not knowing your risk factors, the best thing to do is to keep the levels of the LDL cholesterol very well within target range. How do lipids affect weight? Uh, I No, that again doesn't carry on in a linear fashion, just like lipids affect diabetes. Eating dense caloric intake, eating saturated fats, um, can actually, they're very dense in calories. Fats, when you burn out, they provide more calories. So in that respect, if your intake of lipids is very high in terms of saturated fat, you will tend to gain weight and you'll gain fat weight. So that's how it affects weight, but not that's your exogenous, how you take in your calories will affect your weight. Piyush, is there any relation with diabetes and lipid profile? I thought we briefly alluded to this a little before. The relationship between diabetes and the lipids is that diabetes is considered a very high risk factor for heart disease. So when we diagnose someone with diabetes, we like to keep their LDL cholesterol much lower. In fact, we keep it as low as someone who's already got heart disease. The other relation between diabetes and lipid profile is if you see the high triglycerides are seen in people with diabetes, low HDL cholesterol is seen with diabetes, metabolic syndrome does predispose to diabetes. So that's how the lipids and the diabetes are connected. So I'm glad to see there's so much interest in diabetes because, really that is a very important risk factor also for heart disease. And when we see diabetes, we really have to be very aggressive with the lipids. Yeah, Piyush. Piyush asks, can exercise control lipids? Definitely. In fact, what I mentioned about the lifestyle changes, exercise is a very important factor because lifestyle changes that you make is something which is sustainable for life, right? So those changes will actually help in maintaining besides reducing the cholesterol, even maintaining the cholesterol. Because basically what we do with exercise, we're burning out calories and that helps to mobilize the fats and burn out those calories. So any form of exercise, whether it's brisk walking, it's jogging, getting onto your stationary bike, 30 minutes most days of the week is the minimum we recommend. I'm really very pleased to see the motivation with all our participants. That's exactly what we want to do is get the interest and the motivation to start addressing these silent problems. All right, we'll be ending our session now. Thank you again for participating with our webinar. And like I said, any other questions, feel free to send us a message. Thank you.